Dear viewers, welcome to a new episode of DocTalk, and today we are addressing a very sensitive subject, especially for families: the bottom batteries impaction in the esophagus. This condition is extremely wide and it's everywhere, and we need to address it for concerned families, especially now with returning back to schools season. So we have with us today Dr. Abeer Alali. She will take us through the symptoms, the dangers, and treatment to avoid this kind of conditions and also to raise awareness among families. So stay tuned after this short break. Welcome back, dear viewers, after this short break, and may I present to you our lovely guest, Dr. Abeer Alali. Welcome to DocTalk.
Thank you so much for having me. I appreciate it.
So, Dr. Abeer, before we jump into business and talk about the conditions that we have in our episode today, tell me more about your specialty and what kind of cases that you treat.
So I have a board certification in ENT, which is otorhinolaryngology, head and neck surgery, and I have a subspecialty or fellowship degree in pediatric ENT.
Okay, now let's jump into business. Let's talk about bottom batteries and why they are considered a very dangerous subject or items in the household.
Well, because first of all, the button batteries that we know are very tiny. They are lithium batteries, so they're not the same type of batteries that we see with the AA, AAA batteries.
Yes.
The other thing is that unfortunately there are everywhere, particularly in kids' toys. So they have, let's say, the kids have easy access to those batteries, which is dangerous, especially if they're swallowed. Or inhaled in the airways. So definitely it has significant, let's say, morbidity and mortality that occurs with these incidences. And again, they're everywhere and easy for kids to access, unfortunately.
So they are easy access lethal weapons, let's call them.
They could be lethal, definitely.
Yes.
Yes.
How do they end up in the esophagus?
So we all know that kids, especially under the age of 5, they're curious, they play. And when they see these batteries, sometimes they put it in their mouths.
Yes.
And a lot of kids, even especially younger than 2 years of age, they do what we call mouthing. Means that everything that or let's say they explore their environment by introducing everything in their mouth. It's part of them exploring. So if they see a button battery, they could put it in their mouth and swallow it some occasions. So that's how it ends up in the esophagus.
Okay, let's talk about the age group. You said that it's from 2, let's say 3 or 4 years old, but even let's say older children can swallow them. It's like
yes, definitely.
Dare or let's try fact or dare, some kind of games. But the common age group that are at risk of this condition.
So usually kids from let's say 2 years. 2 years and younger are those who are let's say more at risk, especially because again they're the mouthing and they're exploring and everything. The other thing is even the complications that occur with these cases are more severe in the younger age group than the older kids.
Okay, now let's talk about the cases. Once the baby swallow the bottom battery, what are the symptoms? And if we don't treat it early, or let's say at home or at the site, what are the symptoms that later come with the action?
So the first thing that we need to know that treating button battery has to be in a hospital setting. You cannot do anything at home.
Okay.
So as soon as the case is witnessed, or let's say a parent or a caregiver sees that the baby swallowed a button battery, or even if they're suspecting it's a button battery, sometimes it's difficult to tell the difference if it's a coin or a button battery, but regardless, if this incident was witnessed, the patient has to be sent directly to the hospital in the emergency setting. There's not much that they could do at home besides give honey, and we could talk about that in details when we talk about the management of button batteries. And they have to bring them right away to the hospital. And a lot of cases, unfortunately, are unwitnessed, and here where the major complications occur.
Okay, so we are talking mainly about bottom batteries because of the components of the batteries. Okay, does they stick on the wall of the esophagus?
They don't stick because they're not sticky in nature, but they get stuck
Okay.
So they don't stick, they stuck.
They stuck, okay.
Yes, and the complications occur mainly because the lithium battery, when it is in the esophagus and the presence of the fluid of the body or in the esophagus,
yes,
it creates an electrical current.
Okay.
So this electrical current that occurs breaks down the water in the esophagus to hydroxide and hydrogen ions. And the hydroxide, when it increases in the body, it's alkaline, or it's a basic pH. So it means it brings the pH of the esophagus up. And this causes liquefactive necrosis, means that it breaks down the tissue.
Okay.
And this process can all occur in 15 minutes. So we can have major tissue damage in 15 minutes.
Well, that's interesting. So the moment that the action occurred from the swallowing, so you need to extremely rush faster than any traffic.
Definitely, absolutely.
Yes. So, okay, after you receive the patient and you have you do the ultrasound or you do some kind of examination before sending the child to the ER, to the operation room, or to take another action.
So we try to keep the steps as minimum as possible. And this is also from this standpoint, I could, urge every ER doctor or every doctor that comes across these cases, don't do unnecessary steps.
Okay.
Just quickly, the parent suspected that there's a button battery that they saw the kid swallow, take the child for X-ray immediately. After X-ray, we confirm that it is a button battery, then the patient has to be sent immediately to the operating room to remove the button battery.
Okay. Does that operation may cause complications?
Well,
if not treated right.
So definitely, you have to, first of all, you have to get the button battery out of the esophagus.
Okay.
You have to get it out as fast as possible. And after that, we have to look at the esophagus, because as I mentioned just now, that the damages can occur in 15 minutes, and you could see literally that the esophagus is burnt. So once the button battery is removed, and we usually do it using esophagoscopy, and this is an ENT specialty that we're the ones who do these cases. So we remove the button battery, and then we have a very delicate, thorough look into the esophagus and see what kind of damage was done.
Okay, and the damage usually happens, is it the damage, what I mean, if the damage is removed surgically and we contain the condition, is it going to affect breathing?
Excellent question. Well, first of all, the first component of your question is that even when we remove the button battery, we're not safe.
Exactly.
Because the process is still occurring even when the button battery is removed.
That was
so then you have to keep in mind that, okay, I removed the button battery, which is very important. And this is the goal, actually, is to remove the button battery. But we have to know that we're not in the clear. The complications are not 100% guaranteed to not occur. They still may occur even when we remove the button battery. The other thing is that because we know that the complications and the esophageal damage occurs very early, after 15 minutes, basically, from the ingestion or swallowing the button battery, during the procedure, when we do the esophagoscopy, definitely there are complications that can occur because the damage is already done.
Okay, now let's talk about the parents. What are the symptoms or signs that parents should be concerned about, or to see on a child that he or she swallowed a button battery? Is there any signs?
Well, if it's a recent, let's say, ingestion, like let's say the kid swallowed the button battery 3 minutes ago or 5 minutes ago, he could be completely normal with absolutely zero symptoms. So the fact that you don't see symptoms on your child does not mean that he's okay.
Yeah,
absolutely not. It's just that, okay, it needs, again, as we said, a few minutes, 15 minutes for severe injury to occur. The other thing is that sometimes when the button battery is neglected, meaning that the parents did not see the button battery, or the kid actually swallowing the button battery, they can present with later symptoms. And those symptoms could be something that is simple, like a kid who has a flu. So they might have a little bit of runny nose, they might complain of sore throat, and might have a little bit of fever. Some kids might develop symptoms of difficulty in swallowing. So they have pain when they swallow, they can't swallow their saliva, and this is also a significant sign that also could occur. But believe it or not, the majority of cases, when the kids come into the ER, they're absolutely normal kids.
No symptoms.
They have absolutely zero symptoms.
Okay, Dr. Abeer, we're going to keep talking about children's safety right after this short report, so please stay tuned. Welcome back, dear viewers, after this short report, and we're still discussing with Dr. Abeer the impact of bottom batteries on the child's health in general. So let's talk about the diagnosis of the bottom batteries in the esophagus. Now we are talking about medically or surgically. You diagnosed it. What are step by step before jumping into the X-ray, because the X-ray can locate the bottom battery?
Mm-hmm. So first of all, again, let's take it from home. As soon as the parents witness that the baby ingested a button battery and they're sure it's a button battery, or even if they're not sure, they might think that it's a coin.
Or even a button, any object.
It's particularly metal. We have to make sure that it's metal, because plastic does not cause these issues, or rubber or anything. But when we talk about button batteries, because again, as I described earlier, the pathophysiology or the mechanism, it's because the body, because of the lithium battery, is causing a chemical reaction in the body, and the alkaline pH is increasing. So we have to think of ways to neutralize this effect. So the first thing that we do, again, from home, if we see a button battery, or we saw a kid ingesting a button battery, then the parents, the first thing that they need to give is honey. So honey is, they could give like, let's say 1 teaspoon full of honey, and they have to give it every around 10 minutes to the baby until they reach to the nearest hospital that they have access to. Ideally, it needs to be a hospital where they have ENT services, because it's an ENT specialty. They need ENT doctors to remove the button battery. So once that is done and the patient arrives to the ER, then we do the X-ray. So the X-ray, it's not to confirm where the button battery is. Okay, that helps as well, but it will definitely confirm if it's a button battery or a coin. Because both of them, when you look at them, they're round and they're metal. But when you have a good X-ray, you could definitely tell the difference if it is a button battery or if it's a coin. And as soon as the button battery is confirmed, then immediately, without any kind of delay, we send the patient directly to the operating room, and we don't respect the protocol of fasting, because we know for every surgery, the kid or a patient needs to fast at least for a few hours before they're sent to surgery. However, with the button battery, there is no protocol for fasting, and this tells you how urgent it is and how urgently we need to deal with this. So then the patient goes to the OR, or the operating room, and rigid esophagoscopy is done by the ENT team. Sometimes we need to, call the help for GI or any other specialties that we need them to be around us. And then the button battery is removed. Then the patient needs to stay for a good amount of time in the hospital to make sure that there are no complications that occur, that we initiate proper feeding, and that there's no complications associated with that.
Lovely. So what happens if the bottom battery moved down to the stomach?
So if it moves down to the stomach, then usually we allow the GI team, which is the gastroenterology, to remove the button battery. However, in the majority of cases, we don't remove it. They allow it to pass, because again, the stomach is acidic. So it's going to neutralize a little bit. So it does not have the same danger. The button battery does not have the same danger of it being in the stomach in comparison to it being in the esophagus.
So this is going to lead me to my second question. So if it's in the esophagus, it has certain and big dangers, but if it's in the stomach, because of the environment of the stomach and the chemistry of the two environment, they are different. So, but what if it stays in the stomach? Does that change the...
Usually it doesn't stay, but again, I would like to, let my colleagues, the GI specialty, to respond to that question, because they're the ones who manage these cases. But the vast majority go on their own, so that's why we don't intervene.
Okay, but does bottom batteries lead to bleeding if not treated immediately?
Yes. And so first of all, because in the esophagus we have very, very critical organs and vessels.
Yes.
So just adjacent or behind the, in front of the esophagus is the airway, which is the trachea, what we call the windpipe.
Yes.
So you have the breathing tube, and just adjacent to it, you have the aorta, which is one of the major vessels in the body.
Okay.
And you have the mediastinum, or let's say it's what contains all of these important vessels, the lungs and the heart and the aorta. So everywhere around the esophagus is critical. And it's if complications occur, they're devastating. And that's why if the wall of the esophagus got perforated and just adjacent to it is the aorta, then this perforation also can lead to the aorta and cause significant bleeding and almost immediate death.
So that's why the importance of X-ray to locate the bottom battery before moving to the stomach, it's important.
I would not say so. Again, the button battery, because the entire area of the esophagus is surrounded by this. So it doesn't matter if it's a little bit of a centimeter up, centimeter down, it doesn't change anything. The location is not, the location of the esophagus, then that's it, full stop. We are in danger if it's in the esophagus. And even though the chemical burn, it can, propagate either, ascending upward or downward.
Yes.
So it does not necessarily mean that this is the location of injury and it's going to stay there. It can, propagate onto other sites in the esophagus.
Yes. Let's talk about the medical intervention. Is it like extreme, like a cut on the throat or the neck or through the mouth?
So it is mostly a surgical intervention. It's not, we cannot say medical, because medical means that you give medication.
Yes.
We do give medication, as we said, honey. And sometimes if we're in the ER, and unfortunately it's not located everywhere in Kuwait, but we call this sucralfate. It's also a medication that we give, which we use also for stomach ulcers.
Okay.
It could also neutralize the effect of the alkaline, reaction that is occurring in the esophagus. So this is the only, medical management that we do, but we do not stop at the medical management.
Yes.
We have to go to the surgical management, and the surgical management is through a scope, what we call esophagoscopy, and it's all through a mouth. There's no cuts, there's no wounds, there's no surgery, as in the name of surgery, where you cut and suture. It's just you put in your esophagoscope, which is a camera, and also there's a channel for you to work and pull the battery out.
Yes. Does the child require anesthesia?
Yes, definitely. They have to be under general anesthesia. Yes.
Just to stabilize them, so the doctor could.
No, you cannot do a procedure with a child awake. That is, it's not possible.
Okay. What happens if the medical intervention is delayed for more than 2 hours?
Well, good question that you brought the 2-hour mark. There are studies that showed as long as we remove the button battery before 2 hours from the swallowing time, if we have a total of 2 hours, then usually it is less likely to develop complications. Less likely, but does not mean that we're sure that we don't develop complications. But it is, we do have a 2-hour window where it is the most, let's say, I would not say 100% safe, but it's the best time to act is to get the button battery out in 2 hours from ingestion and not from diagnosis.
Okay.
So let's say the kid had swallowed the button battery at 5 o'clock p.m., then by 7 it has to be out. It has
to be before even
from the ingestion and not diagnosis. Yes.
So Dr. Abeer, we're going to keep talking about children and their safety, but we're going to take a break for a report, and then we're going to jump into one of my favorite segments, Myth and Fact. So please stay tuned after this short report. Welcome back, dear viewers, in our segment Myth or Fact with Dr. Abeer Alali. So let's jump into business. First myth: since the battery is small, it's not dangerous?
That is completely false. It doesn't matter the size of the button battery. Even the smallest button battery with the least voltage can definitely cause significant injury.
Okay. Myth number 2: if the child shows no symptoms, there is nothing to worry about.
Again, false. We said that they can present completely asymptomatic with no symptoms, but it does not mean that complications can occur later on.
Okay. Myth number 3 is my favorite: used batteries are less dangerous than new ones.
So that is completely false. Even dead batteries can cause injuries, and there are studies that prove that let's say, almost completely used batteries or dead batteries do cause the same kind of injury.
Okay, so myth number 4, if parents don't see the child swallow the battery, then it don't cause any problems?
It's,
if they didn't see it,
that doesn't mean anything. So they didn't see it, then does not mean that it did not exist. And actually, it's the contrary. If they did not see it and it did happen, means that this incident is missed, and therefore definitely significant, devastating complications will
So, but the symptoms are there. If
so
they didn't see it, they didn't see it, but the symptoms are
exactly
present.
So if they did not see it, then they don't know about it.
Yes.
And most probably the child will come at some point with symptoms. And most of the time they're very, very significant, dangerous symptoms.
Okay. So myth number 5, giving the child food or drink helps push the battery down to the stomach?
No.
It sticks there.
We cannot assume that the food bolus will push the button battery. What we can give is honey, and that is not to push the button battery, it's to neutralize the environment from the alkaline effect.
So what is the importance of honey? Why it's honey?
Because it neutralizes the alkaline substance that is developing in the esophagus.
Is there the other kind of foods? If it's not honey, what do you have?
No, the only studies that we have is honey.
Honey, okay. Our final myth, parents can wait until regular visits to the hospital to remove the battery?
That is completely false. As soon, and again, I cannot emphasize enough how dangerous the situation is. As soon as the parents see or suspect a button battery, then they have to immediately
go to
take the kid to the ER.
Okay, so that concludes our myth or fact segment. So please stay tuned with us for our final segment for today with Dr. Abeer Ali. Welcome back, dear viewers. This is our final segment with Dr. Abeer Ali. So we're going to talk about something serious. Let's talk about the death rate about this condition. Let's compare Kuwait to other countries and what are the studies that made regarding this symptom.
Well, unfortunately, this is a very, I don't want to say sensitive, but we don't have a lot of studies in Kuwait that tell us about the rates of incidence or mortality rates. However, the general, we have like the global mortality and morbidity rate is about 0.5%.
Okay.
It is a small number, but again, yet significant. It is, so it's not something that we underestimate, even if it's 0.5%.
Yes.
Because again, there are children that are, dying from these, these incidences. So we don't have studies here in Kuwait, but there are death rates, that are recorded. However, because of, our awareness, again, there is an awareness day for button battery on the 12th of June, which is the day for button battery awareness. And this was also because a child, I think that it was the first death maybe that was reported from a death from a button battery that occurred, and the child was around 17 months who swallowed a button battery, and the child's name is Reese Hamsmith, and that patient died on that day. And then since then they did the awareness day of button battery on that day, which is June 12th.
June 12th.
Yes.
Is there a global or international standards to treat these diseases?
There are consensus that are, I would say, mainly central, or let's say center dependent. So every center has their own protocol, but there are, I think that they're trying to usually, or let's say, standardize the protocol. For example, from where I graduated, which is Sick Kids Hospital in Toronto, we have a consensus that is now applicable throughout Canada, which is called the Zakai protocol, again, which is in the memory of a child named Zakai who also died on day 9 from the button battery. So we removed the button battery, or let's say they removed the button battery, and the patient died on day 9 from the removal of the button battery from bleeding that occurred. So again, the protocol was named after the child, and it is, let's say, standardized now in Canada, and they're using it. And I'm trying to, apply it here in Kuwait as well.
Well, Dr. Abeer, thank you for joining us here in DocTalk. We appreciate your outputs and your information about this sensitive topic, especially for new parents these days. Once again, thank you for joining us. And my dear viewers, also thank you for joining us on DocTalk. And until next time, enjoy your day.